It's flying by. It's just hard to believe that it's already the end of March and spring, but now we're ready for warmer weather. So it's just so happy to see everybody else, new faces, and just happy that this group is growing. So I want to tell you about our meeting for next month. So it's always the last Thursday of the month at 10 o'clock. We will be at the Painesville Extension office next month, and we're going to have a pharmacist come and talk all about diabetes medicine. So we're going to talk about some of the new medicines that y'all been hearing a lot in the news and everything. And then we'll also talk about just the regular medicines that you're on. So if you have any medicine related questions, be sure to jot those down over the next month. Come with them and be ready to learn all about medicines. Okay, medicines that your doctor's been thinking about wanting to put you on. This is a great time to be able to get those questions answered. So that's the news for and the flyer. I do want to let you all know that our Kentucky River meetings, just like this, we've been sponsored by Aetna Better Health, and we actually got a $15,000 grant. We found out this week. I'm so excited about that. And so, like, you all get the ingredients for the food bags, they're actually getting grocery gift cards. We don't have the same system there of getting the actual groceries, so they're going to get grocery gift cards. So I'm really excited about that. And we're also partnering with the McGoffin County Extension Office to start a diabetes support group there, starting at the end of April. So if y'all have any friends that live in McGoffin County, just let them know. We're going to kick off their Dining with Diabetes course next month, and then we'll have their support group starting. So that'll be our 9th location. So excited because it all started right here. Right here in August of 2022, and we have grown by leaps and bounds. So happy for that. Well, we'll get started. Today we're going to talk about neuropathy and how it affects diabetes affects all the nerves in our body. And we have Ashley Caden here with us. She's a physician's assistant from Our Lady of the Way, ARH in Martin. And she's going to give you a little bit about her background in with neuropathy and got a good presentation.
About 3 years. I have a lot of experience in patients.
Having a little bit of trouble hearing you. This one. It's the. Oh no, it's fine. Okay, she's now cutting it. Mine works, but I think I have to have it. I'm going to share my screen. Let me get it up, and then we'll. Okay, hold on for a second for me. Um,
Okay, now try the. Okay.
So what is neuropathy? Neuropathy is nerve damage that can occur in our feet, primarily our feet, our legs, and our hands. And what happens is there's these nerves all over our body, and these nerves send signals up to our brain to kind of help communicate about our positioning, our feeling, pain, temperature. And when these nerves get damaged, there's miscommunication between our brain and our body.
I might just have to do it.
Okay, that's okay. So there are many different causes of neuropathy. The most common one is diabetes, and type 1 and type 2 diabetics can develop neuropathy. But there are also many other causes of neuropathy that your provider may want to rule out prior to diagnosing you with diabetic neuropathy. Some of these causes would be a low B12 level, either from not getting enough B12 in your diet or from previous stomach issues or stomach surgeries that you may have had causing your B12 to be low. History of heavy alcohol use can also cause neuropathy or nerve damage. There are also certain medications that can cause nerve damage. Most commonly would be chemotherapy drugs used to treat cancer. Some other causes, especially in this area that you may not see in other areas of the United States, would be Lyme disease. If you've ever had Lyme disease, you are more at risk for having neuropathy or nerve damage. There's also some hereditary disorders that can cause nerve damage. These are typically passed down through families and would be diagnosed earlier in life rather than later, like with diabetic neuropathy. So what are some risks of developing diabetic neuropathy? High sugar or high glucose levels over a long period of time can put you at risk for neuropathy, as well as obesity or being overweight. High triglyceride or high cholesterol levels can increase your risk for neuropathy, as well as smoking or any form of nicotine use can increase your risk for neuropathy. Okay, so there are many different symptoms of neuropathy, and these symptoms can kind of be broken down into two main categories. You have the sensory symptoms, which are typically occur because of damage to the sensory nerves, which have to do with pain, feeling, temperature. Most commonly, you can see numbness. They're primarily in your feet, but you can also see a tingling sensation, burning sensation. Sometimes you may even have kind of increased sensitivity. So things that may not have caused pain to you previously or before you had the neuropathy can actually cause increased pain. So an example of this would be if you're laying in bed at night and a sheet touches your leg. Normally that wouldn't cause any pain, but in patients with neuropathy, that could cause a lot of pain. And so when you have these numbness, the tingling, that burning feeling, that can then also lead to some of these motor symptoms that I have listed up here. When you have the pain in your legs, you may kind of, when you have I lost my train of thought there, I'm sorry. When you do have that pain in your feet or your legs, you may kind of alter how you walk. So when you do that, you may be less likely to get up and to exercise because you're afraid maybe you're going to be in pain. And so that can then lead to weakness in your legs or your arms, which can then lead to muscle shrinkage, or as I have up there, muscle atrophy there in your legs or your arms. Some other things that you can see with neuropathy is unsteadiness. So when you're on uneven ground, more usually when you're on uneven ground, you may see that you feel off balance because those nerves aren't communicating properly with your brain. And that puts you at a higher risk for falls. You may also find when you go see your primary care provider or another provider, if they check the reflexes kind of in your knees, normally they would jump and jerk. And however, if you have neuropathy and the nerve damage, you may get a decreased or no reflexes at all. And And another thing you can see is foot drop. So there's a nerve in our leg. It typically runs right down through there that controls the movement of our foot and helps kind of pull our foot up. When that nerve gets damaged, then you're not able to lift your foot up. You don't see that as commonly. It's probably one of the least common symptoms with neuropathy, but it can happen. So how do you diagnose neuropathy? Most commonly, I would diagnose neuropathy just based off of a patient's history. So if they are a known diabetic and they're starting to have the numbness or tingling or pain in their feet, that would kind of clue me in that, okay, they could be getting some nerve damage there in their leg. But another thing that your provider may do during your annual physical is something called a monofilament test. They basically take a little piece of nylon and they tap it against your foot and your toes to see, can you feel it? And if you can feel it, can you pinpoint it to the right location on your foot? And if you can't, then that could kind of indicate that you could be developing the neuropathy or nerve damage. Another thing that can kind of diagnose neuropathy is an EMG or a nerve conduction study. And these are typically done as an outpatient, and they hook these electrodes up to your legs or your muscles, and then it'll send a shock or like a little zap or electrical impulse to your nerve to see if we get a response back to see if you have neuropathy. And if we don't get a response back, or if the response to that little shock is slower than normal, that could mean that you're developing the neuropathy or nerve damage. And if so, then that machine will tell us, is it mild, moderate, or severe nerve damage? And then that kind of brings us to treatment and what you can do as patients and how your provider can help you treat and control the symptoms of neuropathy. And that can be broken down into 4 main components. That would be controlling your sugar levels or your glucose levels, lifestyle interventions or lifestyle modifications, as well as taking care of your feet and having good diabetic foot care, and then pain control. So with lifestyle interventions, there's really 2 main things to focus on. One would be exercise, getting about 150 minutes 3 times a week of moderate to vigorous exercise. This could be things such as swimming, jogging, brisk walking, just to help, one, lower your blood sugars and help lower your weight, which can help lower your risk for developing the neuropathy, as well as having a good diet. And if you've been to these meetings before, I'm sure they've talked to you about some good recipes that you can do and healthier recipes that you can do to help control your sugar levels. So having a diet that's low in saturated fats. So if you eat a lot of red meat, maybe trying to choose the leaner meats like ground chicken, ground turkey. Those are better for you and better for your sugar and your overall health than the red meats. And also having a diet that's high in fruits, vegetables, a diet that's high in whole grain like bread, pasta, things like that can really help control your sugar levels, which can in turn help prevent your risk for developing the neuropathy. And then I don't know if this video will work or not, but this is just a little video on diabetic foot care and trying to help prevent ulcers and wounds from developing on your feet. If the sound will work or not.
It should work on. What are you trying to?
If none of that's okay too. I'll give a brief rundown of what it is.
Yeah, sorry.
Oh, that's okay. So that video was pretty much just talking about how at least once a day you should check your feet for any sort of cuts or wounds. Because if you do have neuropathy or nerve damage and your feet feel numb, you may not notice if you step on something or you get a scrape on your foot. And those scrapes in diabetics can become much worse very quickly. So just at least once a day, check your feet. And it helps too to wear white socks. That way, if you were to get a scrape, you would be able to see if there was any bleeding, and that would kind of clue you into that maybe there's a wound on your foot.
Okay.
So the biggest question that I always get asked, when I see a patient who may be developing neuropathy is, what can we do to control your pain? And so if your primary symptom is numbness, there's not much that we can do to help with that symptom. But if you have a lot of the tingling pain, the burning pain, we can use medication to help control those symptoms. There are several different classes of medicines that we can use, and you may already be on some of these medicines for other reasons. Cymbalta, Effexor, and Elavil or amitriptyline are three medicines that technically were initially marketed for depression or anxiety, but can actually help with nerve pain by controlling the pain that you're getting from those nerves. Another class of medications that can help control pain are seizure medication. The most common ones we would use would be Trileptal or Tegretol. And even gabapentin was a medicine that initially was used for seizures, but after they got it on the market, they found that it does actually work pretty well for nerve pain too. And your provider may try one or all of these medications, depending on what other medicines you're taking, to try to control your pain with a neuropathy. And then if for some reason none of these medications help, the next step would be something called a spinal stimulator. And that's where they insert a little device in your spine to kind of help block or control the pain signals. That's more of a last resort. Doesn't happen very often, but usually it would be done by a pain management doctor. And so some complications of neuropathy that you just got to watch out for are falls. Like I was saying earlier, neuropathy can put you at risk for feeling unsteady and off balance. And when you feel like that, you're more likely to fall and you're a higher fall risk. So some things that you can do or talk to your provider about to try to prevent this is use a cane or a walker, or even get some physical therapy, and they can work with you to try to help you alter your gait or your walking so that you're not as at high of a risk for falling. And another thing, which we kind of already had talked about, was the foot ulcers, and just making sure that you're checking your feet every day for any wounds that aren't healing. Just because if you are a diabetic, it's harder for you to heal. But then if you have the neuropathy, it's harder for you to know that you have a wound. So if you aren't checking your feet every day, just make sure that you are, so that hopefully will not develop any of these foot ulcers, or if you do, you can catch them early and get to your provider and start treatment for it. Yeah, so hopefully some of that information was helpful to you all. And if you are having symptoms of neuropathy, then talk with your providers and see what the next course of treatment would be for you and what the best fit for you would be. But the best thing you can do is just trying to control your sugar, your glucose levels, so that you don't even develop neuropathy. Does anyone have any questions? Yeah. 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 Right. chair yoga is a great thing to do, and also incorporating with the resistance bands. You can use those on your legs, your hands. That can help you get good exercise, especially if you already have other medical problems that make it harder for you to walk. And swimming is also a good one if you have access to a pool, because that's easier on your joints. And that can make it a little bit easier to get some good exercise in. But the chair exercises are a very good idea if you do have arthritis and it makes it hard to get up and walk around or run or jog. And so like you said, YouTube is a good source for information as far as finding videos, chair exercise, chair yoga. Sometimes you can even find like the little, I'm not sure exactly what they're called, but they like a resistance ball, I guess. That's a good source too to help exercise your hands if you're starting to get the neuropathy in your hands. Does that answer your question?
Sure, I mean, it'd be great if some actually.
So there are. Yeah, so we actually had a meeting that was all about chair yoga. And we actually done the chair yoga during the meeting several months ago. And the lady usually is here every month that leads it. So I'm not sure if you live in Paintsville or Prestonsburg, but in Paintsville, at the rec center, she teaches it on Thursdays. I believe it's at 11:30. And they also do it at the library, at the health department, several places around that does chair yoga there.
There's a lot of online.
Yes.
I think senior care in Prestonsburg, they used to do something like that as well.
I think she said she's from Pike County. Is that what she just said? Oh, yeah. Yeah, the health, I was trying to think of the lady's name that's at the health department in Pike County. I can look at it after class is over, and I'll reach out to her and ask her, if she knows.
You have to be bigger.
Mhm.
You don't have
Yeah. Okay. I'll try to find out for you. Kathy, do you all have a question?
Yes.
that y'all
Yes.
like to ask?
Yes, one of our participants, her name's Sheila, and she has a question.
Okay, my mom has,
Can't hear ya.
Hold on just a second.
But you may be able to type it out and then I can ask for you.
Yeah, we can type it out. Can you hear me?
You're not on mute.
Can you hear me, Ashley?
No.
Oh, okay.
If you're a pre-diabetic. Okay.
So you can, but it would probably more so be for other reasons, like the ones I mentioned earlier. Just because normally diabetic neuropathy is caused from your sugar level being very high for very long. But like I said, if you have a vitamin B12 deficiency, any of those other reasons that I had listed.
Her hands feel, I always feel like they're saying it.
Okay,
She's not saying it.
okay.
Is that?
I figured out what I
And
needed to.
everything else she touches too. Her hair, her legs. It feels sandy.
You don't have to type it out now, Kathy. We can hear you.
If anybody in Floyd County wants to do the chair yoga, it is done at 1 p.m. on Mondays at Highland Terrace in their big room there, and it's open.
Kathy, can you hear me now? Okay, she says that her mom has a feeling that her hands and things she touches feel as though they have sand on them. Could that be neuro?
It could be, I've heard a lot of different descriptions over the years of patients with neuropathy. I've not heard one specifically like that, but it could be. I've also heard someone tell me that it feels like a little tiny bee sting just over and over on their feet or their hands. Yeah, and I hear that one very often. I've also heard someone say that it feels like a really tight sock or a really tight sandal wrapped around their foot. So there's so many different variations and ways neuropathy can present. And so if you have anything kind of out of the normal than what you're used to, it's worth bringing it up with your provider and just talking to them to see, could it be neuropathy? Could you be developing that? And that way you could kind of get a head start on trying to lower your sugar or trying to figure out, is there another reason for why you're developing that nerve damage?
Going back to the bee sting.
Yeah.
Does it, can it be in other parts of your, because I get them my arms. I mean, it's just not like my feet or my legs. I get them everywhere.
You can.
It'd be like somebody is, shocking.
Yes,
If that makes any sense.
it does, because that's exactly
It
what
stops you, you're like, oh, God.
it does. It kind of takes your breath
Yeah, it's
sometimes.
like my arms does, I mean, different parts of my body, just not my legs and my feet.
Yes, and so I mentioned the leg and the feet because mostly that is where it kind of starts and people have that nerve damage, but you have nerves all over your body, so it can affect any of those
Any
nerves.
part.
Yes. Any other questions?
So, the lady in county, if you know other things, I think, like, your yoga. Julie Chain that works for my county health department, one of the instructors, she currently does not have a class, but is welcome for people to contact her. And be more willing to look into possibly starting. So just contact my county health department, and ask for Julie Chain.
Perfect. I couldn't remember her name. I'm glad you were here, John.
Why did they quit? They didn't quit, they do it in Highland Terrace, that was where most of the people that were taking it were at, so they just took it where they were at it and had to travel.
Okay, because I kept checking the health department.
Yeah, they do it, they just do it at Highland Terrace, because that's where most of the youth want it, live in Highland Terrace.
Any other questions?
Any other questions that you can think of?
Oh, yeah, that's fine.
Yeah, I can get those for you. Yes.
Anything else?
Okay, thank you.
Thank you. Well, I hope that helps.
Okay. Well, what?
Is there anybody that A1C check?
A1C check. Anybody wanting to?
Good morning, everyone. My name is Kathy, and I'm with Kentucky Home Place here in Floyd County. My office is back in the Mountain Complex in town in Prestonsburg. So she asked me to come and just give you an idea of what Kentucky Home Place can do to help you guys. And some of the things that Ashley was talking about, we also kind of give you education. Like, you can learn some things, but sometimes your doctor or nurse does not have time to sit down and talk with you in depth. So we work with the CDC to be able to give you that information. Along with like different exercises to do. We would help you find that chair yoga or exercises on the internet for you, just kind of things like that. Kentucky Home Place has 32 different community health workers in Eastern Kentucky. So there is one in Pike County, here in Floyd County, Johnson County, McGoffin County, all over Eastern Kentucky, we have somebody. So I have some flyers here that you can take, and you can call me, like if you're in Pike County and don't know their number, or in McGoffin County, I can give you their numbers so you can get in contact with them. One thing that Kentucky Home Place does is we help with, if you're having trouble getting your medications because your copays are too high, then if there's a program out there, we will help you fill out that program papers to where you can get that medicine at either free or low cost. If you're having trouble with being able to get eyeglasses or an eye exam, we have programs we work with if you're in the income limit to be able to get you an eye exam and a pair of glasses for maybe $25. Or if you have insurance that you can get your eyes examined, then we can get you a pair of glasses online for $10. So we do a lot of different resources. Most of our counties have diabetic shoe days. So, you know, being a diabetic is very important to take care of your feet. And diabetic shoes are the number one asset to have to be able to help with your neuropathy, or if you have an amputation, the companies can help adjust with that also. We help with, like I said, a lot of different resources. You come in with a problem and I will do my very best to help you find a solution for it. To give you an example, I had a gentleman come in a couple of years ago on Social Security or SSI. He was disabled, but had student loans. And he would talk to me and he would say, well, I make $700 and some a month, but they take $150 out of that for my student loans. He didn't realize that being disabled, he could get those student loans dissolved. And so I was able to research that for him and was able to save him that $150 extra a month where he could have groceries. So as a problem comes into our office, we're always trying to find different resources for those. So I have the flyers that I have just kind of touch the surface of what we can do. We help with medical equipment. Say you need crutches or wheelchairs or even a cane. We have a program that we work with that they get products donated to them, and we have students that clean them up and fix them, and then we are able to get them from that program and give them out to our people for free. So I have my flyers back here at my table. If you guys are interested, just holler at me at the end of our support group meeting. Is there any questions? I know a lot of you probably have never heard of Kentucky Home Place, but we are the best kept secret is what I always say. So if you guys have any concerns, or you just want to take a flyer and call me and have a more detailed conversation later, that's great. I'm always there, always ready to help. Thank you, guys. Thank you.
Yeah, you might want to pick that. Yeah, there we go. All right. You want me to go ahead and get started, Ashley? Okay, all right, so what we prepared today was the $1 million spaghetti squash, and I already have it prepared for you all. This recipe takes about 2 hours to prepare. So this is more of like a Sunday recipe or like a weekend recipe, and you can save it for later on in the week unless you have like 2 hours to prepare during the weekday. Like if you get some extra time to prepare it. Huh? So I have samples up here, Ashley and Heather. Do you all want to pass out the samples? And I actually brought up the idea of doing the 45 calorie bread because it's lower in carbs, and to toast it and do garlic butter on it. So they're gonna pass that out as well. So the recipe calls for a single spaghetti squash. It is a Kentucky ground vegetable. And they are grown a lot in Kentucky. They're great. They're lower in carbs than, they only have like 5 carbs per serving versus like a regular thing of spaghetti. I don't know what that is off the top of my head. It calls for half a cup of sour cream. I did light sour cream. A block of cream cheese, which is 8 ounces. And I did the 1/3 less fat. It calls for not a tablespoon of salt. Woo! A teaspoon of salt and a tablespoon of parsley, some olive oil and marinara sauce. I got the no sugar added marinara, so I hope it turned out okay. The consistency with this is a little bit thicker than traditional. So you might want, I had to add quite a bit of water. It still had about this much at the bottom whenever I emptied it. And a pound of ground beef. I had to use what I had here at the office. I used turkey instead of ground beef. So I hope this goes okay. I'm Andrea Sloan. I'm the FCS agent here. To hold a knife properly is to pinch and grab. So spaghetti squashes are very tough. And you cut both ends off. So I have a garbage bowl here. And then you just kind of go around because you want to cut it lengthwise. To start like a cut line. And then you flip over the other side and do the same thing. Spaghetti squash is very tough. And sometimes it's just easier to give it all your might. And that's what it looks like on the inside. I'll have a paring knife to kind of go around and get all the seeds out. They're like a butternut squash kind of in the center, or like even a cantaloupe. So I go around, get all the seeds out. And while you're doing this, you have the oven preheated to 400 degrees. I did that and I baked it for 1 hour. That was a suggestion. And I'll show you all the spaghetti squash, how it turned out. Because I think you might need to bake it for a little less time. So I'm just scraping the seeds out.
You recycle any of that?
You can,
Compost?
you can do compost. We have compost bins here at the office.
I just wonder if y'all compost it here.
Yep.
Yeah.
And then you do about a tablespoon of olive oil. I'm just gonna put like a little bit of a drizzle in here. And I have like a brush here. I'm gonna brush all around the edges here. And I'm probably not even going to use a teaspoon of salt. I'm just gonna sprinkle salt across the top here. And then this is how you put it in the oven. Pretend this is a cover, but pretend this is like a baking pan. This is how you bake it. And when it comes out of the oven, you want it to be fork tender. So I baked it the full hour. You want to be able to puncture it pretty easily with a fork. And so I feel like it got a little burnt for my taste, so you just do this. And isn't this the neatest thing?
It is. Looks like spaghetti.
I know. So you bake it for about an hour. You could even lower the temperature to 375 maybe for the hour. Just do maybe 45 minutes instead of an hour at 400.
Yeah, that's really tasty. Oh, good.
And there's different ways you can prepare spaghetti squash. This is like a neat way you can do it, like traditional spaghetti. Some people eat spaghetti, like put the sauce in it, like just leave it, use the shell as a bowl. That is more of a question for our ag agent, but I know all squashes other than like hard shell squashes last quite a bit longer than like say zucchini. Zucchini would probably have maybe a week to 2 week lifespan after you harvest it. This has a longer, it's definitely longer.
So after you grow them, and where would you store them in your home? Or how would you store them?
Like as food preservation,
Uh-huh,
yeah, probably your best bet would probably be frozen.
frozen.
And I do not know I can figure that out for you, but I know we have.
Because I'm assuming, if you grow those, you can grow quite a few of them.
Yeah. And I kind of cheated. What I got, Food City only had 2 spaghetti squash today. So, but they had frozen spaghetti squash. So what you all are eating is the frozen spaghetti squash.
And they'll order them, at the Paintsville, Food City ordered 45 for me. So if you ask the produce manager, they'll order for you. And then this one, I've also tried some of the low carb noodles to see how those work out. And I have the bag here.
I'll have it. I'm sure.
Okay, good. That's the ones that I tried, just from, Food City or Walmart. It's not a big bag, I will say that, and it was $4 and something, but it has very, very, very few carbs. And we ate it with, Alfredo and chicken, and it was really good for, how many, like 4 carbs or something?
It says 5 calories on 1 net carb per serving.
Yeah, so very few. So there are different options and our recipes this year, I'm trying to do a recipe makeover. So, our normal carb filled meals, trying to give you all an idea of how to do, fewer carbs.
How did you?
I froze it, I froze the spaghetti squash. Oh, the frozen spaghetti.
You put it in the microwave or you do it on the stove since there was so many bags. I did drain it, yes. I did not drain that, as you can see, but with the pasta sauce, I just did traditional pasta sauce. I browned the ground beef, not green beef, ground beef. Prior. And I'm adding a little bit of water to it to get the rest of it. I'm adding the no sugar added.
Anybody else need a plate?
And I'm just combining these two. And pretend that I'm doing this over a stove. And while I'm letting that cook on the stove, I'm adding half a cup of sour cream. Tablespoon of parsley. And it did not specify dried or fresh, so I'm assuming dried on the recipe. What did you all provide, fresh or frozen? I mean, dried.
I'm sorry, parsley is the only thing that we didn't.
Okay.
Do. Yeah, everything else is in the bags, and whenever you all get them, the spaghetti sauce is in a separate, container, because I was afraid to put it in the bags, it would have been horrible. So get a bag and a container, to take it.
So I'm just kind of combining these two. It said to mix it, but with the cream cheese, it was just as easy to do with like a spoon or like a spatula. How's the garlic bread?
I love it.
Good.
Very good. Everything.
It was the 35 calorie bread. Huh? It was just regular white. I was going to get whole grain, but I didn't know. Sometimes it tastes a little funny if you add like certain spices to it. So I stuck with the regular white. And this is a great way to increase your vegetable intake too. Something I feel like I definitely need to do. So I'm going to add this first. And I let the spaghetti squash cool for at least 30 minutes before I even touched it because it is hot when it comes out of the oven.
A Zoom question about the Kentucky Home Place. She was asking, she knows that you're, for Floyd County. She was asking if you can help other counties or if, they would have to go to their specific, person in that county.
I don't care to help anybody.
Okay,
So if they come in my office, I will take care of them.
okay,
If they're on the telephone, I'll take care of them.
great, great.
And all my girls are wonderful, that's what I'm doing too. They're all wonderful. But if you feel more comfortable coming to me, absolutely, I'll take care.
Okay, and if you can, email me your flyer, I can send it out when I send out, Ashley's flyer.
So then after I do the cheese, not cottage cheese, cream cheese, sour cream mixture, I'm adding the 2 cups of mozzarella, and I chose thick mozzarella. Then I will put it in the oven at 375 and bake it for 30 minutes. And you could probably sprinkle some parsley on top to make it look pretty too. And that is the recipe. Yeah, was it good? Did y'all like it?
It's delicious.
Good.
Very delicious.
Sorry, should be on the third.
Do you all have that? Okay,
413.
that's not bad.
Is that like a cup? Is that what it's in or just serving?
Serving.
It makes, so this makes 6 servings, so it would be. It's a big serving. It would be about this size.
Yeah.
21 grams of carb, of protein, so that's a great serving of protein. And only 10 carbs.
No.
And I covered this. I don't know if it says to cover it or not. I went ahead and covered it.
It says the ground beef, if you put it in a plastic cylinder with the goodness of the leaf, you can do it in the microwave and all that fat goes in the bottom of it, you have to wash it or rinse it.
Oh, really? I didn't know that. I always like cat on. And
I used to, I took a GE class when I got my first microwave many years ago. And they said, put a plastic cylinder with the meat in it, with a good dish underneath. And if you put it in for like a minute, 30 seconds each time, and stir it around and shake it up, and it falls brown. But all that grease falls to the bottom.
that's a good tip. I always either rinse mine or pat it.
I've been doing it like this since about 1980, whenever my first one. It works.
Anybody have any questions or anything they want to share?
I just really.
Oh, thanks. Well, thank you. I love all the tips she gives. Did everybody sign in? Did everybody sign in today? I think I counted more people than what I have on the. Yes. Let me make sure that everybody gets credit for when all would come. And we do, anybody need to sign in? Anybody need to sign in? Okay, so we'll be back in Paintsville next month. And we'll be at the extension office talking about medication. So remember just to talk, to think about, your questions on medications for next month. And, whenever you leave, just grab your bags here and don't forget to get the, container of the, spaghetti sauce. Okay.
Thank you.
You're welcome.